We have open Jackson, we have flat Jackson, and we have Wilson frames open and closed that go on both. Different surgeons call them different names. So open Jackson, also Jackson 5 because 5 pillows. There's an open Wilson frame that only fits on the open tables. It's open in the middle, it fits right on the rails, and it wraps up underneath. Then you have your flat Jackson, literally it's a flat table. You can put a flat Wilson frame on top of the flat Jackson. Same thing, wraps up underneath. Actually, y'all use the ratchet straps. Never mind. What else? I think that's pretty much it. Open Jackson, flat Jackson.
Lots of different reasons to use the flat Jackson, like our arthrectomies, things along those lines. They're not just used for spine. The biggest thing with these beds when you first come in the morning is check them, okay? Make sure they're locked. This does not have a central locking system like most of the other beds do. You actually have 4 little tabs there and they will lock. It's not easy to move around. It's very difficult to move around once the patient's on the bed, so just be aware of that. Make sure when you come in that this is at its actual lowest position, okay? The way you adjust that is very similar to everything else. You pull pins out, and then you can move it up and down, okay? But 99% of the time, you're gonna leave it in the down position. Some of the older neuro beds used to not go up or down as high as this thing will. And some of the docs, like Dr. Campbell, who's now retired, so we don't have to worry about that, would always want to step on step stools because he was trained on other beds. You can see that height is no longer really an issue on these beds unless you have Donnie doing surgery for you. Also, these beds can and will rotate. And Dr. Schlifka is here. He likes to scare us all by doing the 360 turn.
Rotisserie.
The rotisserie, that means during an anterior posterior, you don't roll the patient off and roll them back on. They stay on this bed and you sandwich them between a couple of pieces of equipment and then you just roll them. You hear that sound? That is the electronic brake letting go. Again, when you come in the morning, make sure this is locked like that and that it'll still move a little bit, but just make sure it doesn't go anywhere, okay? The last thing you want to do is flip a patient on this, that be all unlocked, and the next thing you know, whee, okay? Again, the beds can be used for a lot of different procedures. Between this, the Hannah table, and the T-Max, they're probably the scariest beds we get to play with because you can really injure somebody really well. If you're not familiar with positioning, what's the rule of thumb? Don't do it without the surgeon. Okay? A lot of them have PAs, I'm in the room, Julia's in the room, so we can position without them there. We had big discussions about this years ago, about, oh, you can't flip a patient. Well, can you put a patient on lobotomy? Yeah, why not? Exactly. It's positioning, it's comfort level. If you don't know what you're doing, don't friggin' do it. All right? Some of the docs, though, they're getting spoiled around here, but if they need to be in the room, they need to be in the room. Okay?
And they will help you.
Yeah, they have no issues with it. So, if there's any questions about it, if you have any questions about it, don't hesitate to grab one of us. Okay? There's all sorts of accessories that come with these beds that we rarely use. Don't expect anybody to know them all. So just come and grab one of us. Okay? They're hidden around here because they're so rarely used, we don't like to leave them out. They get broken, they get lost, blah, 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 yada, yada, yada. All right, any questions? Yes, ma'am.
When I was calling the impact of Williams the other day, on the preference card, it said if it was more than 2 levels, you
Yep.
just said, so is there like a universal
No.
rule of thumb or it's just
unfortunately, with positioning as far as laminectomies and whatnot like that versus fusions, it used to be they all wanted it to be on this for the fusion. A actually wanted to be on a Wilson frame. You know, it's one of those things where it's weird and it's completely physician preference. BAM's one of these ones where it's more than this, but if he walks in and sees the bed, he's like, now whatever. Unfortunately, there's an algorithm. Most of the time, they're doing a little bit better job actually checking off the box what they want on the booking machine themselves. So.
Usually on the back of all your pick lists, there'll be a checklist that they'll go through and tell you what position they want them in, what bed they want, meds they want, different retractors, if they want neuro monitoring, cell saver, microscopes, all that stuff will be on the back. If you flip all the way through, you get a packet of it in the back. It should specify what they want. But yeah.
The crank is there for the Wilson frame. It's actually a Bose system, so you can actually, in normal state it's like this. With that crank, you can actually flex the patient even more, okay? The big thing with this is, please, see these right here? They look like lovely little hangers for them. They're not. If that goes like that and you drop the bed down, this bed doesn't care, and we'll start snapping it, and it will have such a horrendous, loud snap. You will shit yourself. I promise you. Then they're kind of, we broke that company. Yeah, they're about $400 a piece. Okay, we only have a couple left. So, either right there, or believe it or not, there's actually an attachment on the Wilson frame where you're supposed to put it when you're done with the Wilson frame. Don't leave it on there during surgery, or else you get a lovely picture of that when you do X-ray. Anything else? It's an excellent question. We have one.
If you put one on maybe somebody doesn't put one on their flat, or you
So the open actually has channels on it. It's somewhat difficult.
You can't put it on flat because it's got channels to fit on.
It really does in the room.
It's got channels. You know what I mean? It won't lay on there.
Yeah,
So the channel
it's
will-
in the specialty
That's it.
room.
You got it.
I have it.
So we have the open, which goes on the rail system here.
I'll grab it.
And then we have the flat, which goes on the flat jacks in there.
Scott, turn that around.
It's really difficult the way these guys see the channels to do it any other way, okay? I'm not saying it can't be done, but it has, but it's really difficult.
they're not like an easy mix.
No, they're not. No.
You lay this on there, you know it won't sit on there.
Good question, for sure. Anything else about the Wilson frames? You know, Luke?
Oh, yeah, this one's good.
The emotional support nurse.
Yeah.
All right, Gracie's gonna go over the bone flap kit.
So, we have, when we do crannies, we get a bone flap sometimes. Sometimes they can't put it back on the patient, so we need to freeze it. And there's this kit right here. So we open it on the sterile field, and it has, where did you open this?
That's not the one we did yesterday.
Oh, no?
We can still.
Oh, okay. So when you open it, you just drop this in the sterile field. There's all the instructions in here. And I found out, because I never did this before. Then you open this other one.
So your scrub tech's opening the inner pack.
Yeah.
Has everything in it you need.
So there's a marking pen. There's some labels. And all these labels, you need to put the information of the patient, all the information with her. And
Fill it out beforehand.
yeah, there's 1, 2.
So you're passing off the label to the nurse?
Yeah,
Pass
no,
off-
just
pass off a
one.
label and
Just one in this bag, the last bag. So the first bag is the biohazard bag.
It says all this on the instructions, by the way.
And then you put a label on that bag. Then you put, there's another bag, there's like 4 bags, 1, 2.
These are just like your sterile peel pack.
So you put it in here, then you put it on this one, and you put it on this one. Each bag with the label before you pass it to her, okay? And the flap is gonna be wrapped all around with these 4x4s before you put it in the bag. That's basically it. And the instructions are well done there.
Bone flaps are kept in our freezer, in the implant room, top freezer left side.
How long can they stay? Forever?
We don't know.
I asked you that question.
Honestly, don't know. I imagine it's somewhere in the 90-day realm, to be honest with you. By the time 90 days rolls around, either that patient has that bone flap back on or they're no longer needing it.
Yeah, oh, the other thing is like, you know when you do cranny, you wet the flap. So don't worry about it like wrapping it on the 4x4 get wet, because okay, it'll freeze, but then when you have it back, you just toss it on,
Do they recommend wet?
with this bag, at least you take it out of the other bags and you put the flap.
Because it sits on the sterile peel already wet.
Yes.
Right.
Underneath the wet
Yes.
lap. So it
Yeah.
doesn't matter if you dry it off or stick it in there wet.
Yeah, we were thinking, oh, the 4x4s are gonna get stuck on it. No, when once you defrost it, it'll just come out easy. Yeah.
Where is the bone flap freezer log?
Oh,
Oh, right here, on top of the emergency cranny cart. There's a little binder. It's cute. So you'll put patient sticker in it, you'll put your name, date, sign it. Thank you.
Where the actual physical freezer is the
Bone room.
yeah. But she's the one, she gets the last bag because she has to log in. She has to do the last.
Yeah, so
put it in the freezer.
the nurse will log in.
It's not that scary, the information's in there, the first time I
Oh,
ever.
yeah.
Like 2 in the morning, it was like, you know, I did, I'm like, no, I'll figure it out. Hour later.
Yeah, all the instructions are honestly right here. It's easy to follow.
I have a question that's somewhat related, just because you typically would use the Mayfield. Who's responsible for keeping the pins out of the Mayfield? Surgeons that come in and put it on the patient. And I remember not too long ago when we were on the other side, somebody got stuck by a Mayfield pin and they don't remember what the answer was.
I would think that's everybody's responsibility. So when someone notices that it's off of the patient, let's get the sharps removed, because that's how people get hurt.
Most of the time I work with the surgeon, I'll tell you, there's no, to my knowledge, there's no hard fast rule about that. Most of the neurosurgeons I know will take them out and throw them in the sharp spots. And if they don't, you don't feel comfortable out, remind them. Most of them have no problem, because if you're gonna get stuck with something, if you've never played with those pins, right next to the medium vac drain going through your hand as you're pulling it through, those are the world's sharpest pins. They do not mess around, all right? So if you don't feel comfortable, because they can be in there, and if you're not used to playing with it, you don't know how much force it really takes to pull those guys out. Neurosurgeons or their PAs or NPs, what have you, just say, hey, can you get rid of the sharps for me? And they will, okay? And if they don't, come chat with me, I'll have a chat with them.
Yeah, for me.
Yeah, so, all right, crane cart, emergency crane cart.
Should have everything on it that you need. It has all the attachments for the Mayfield, clamp that goes onto the bed, your head clamp, and then also the horseshoe. Depending on what your surgeon wants to do, depending on location of said tumor or whatever's going on up in the head, depends on which piece he wants to use. Sometimes we even use a gel donut.
VP shunts and whatnot like that, but for emergency situations, I've never really seen them use a donut.
Yeah.
They usually want them pretty darn stable. So horseshoe, they'll tape it. Mayfield, clamp down on them. What's your responsibilities at 3 o'clock in the morning, because that's when cranes happen? Making sure it's in the room. Most neurosurgeons don't trust anybody for good reason, and they will come and check and say, do you have the Mayfield? Yep, I do. All right. It's 3 o'clock in the morning. You'll be amazed how quickly those guys can put that thing on the bed and get it checked out. So they still walk around when I do it. And still, I'll see him reach down and grab it and move it just to make sure it's tight. So, just make sure you have all the parts. So, which parts do you need?
Is there a picture of the parts that go together?
So,
Yes, maybe.
We had a picture on a poster.
I was gonna say.
Oh, yeah.
so this is the clamping system, the rails to the bed. Generally speaking, we use just a regular bed. Okay. Some docs want it turned one way. Some docs want it turned the other way. The thing is if you've got the base of the bed right here at their feet, if they're using the ENT chair and whatnot like that, they can't roll underneath. Okay, so just kind of keep that in mind. But some guys want it one way, and again, if you don't know, don't put it on. Okay, they'll do it. This goes on the rail system, gets tightened down. This piece goes in these holes right here. Okay, this is the articulating arm, which I have upside down. And then this is the skull clamp, okay? 3 pins, 1, 2, 3. Again, these guys are in here. So if you haven't played with this and you try to get it out, you see how you can end up with a little poke in your hand. We'll put it on, usually a little basset trace and a little something on the pins. Some guys do, some guys don't. And then crunch, headpiece off. They're holding the head, okay? That is their responsibility. You can help them move this around, but you'd be amazed. They learn this in their fellowship program. They can work every one of these things with one hand on the head. And they turn this around and they put that in there and they lock, lock, lock. Just be there at the head to help if they need it, okay? Don't be off doing your computer. Don't be off doing anything else. Head, you, surgeon, anesthesia. Lock down, done, okay? Then they'll kind of twist it a little bit. Remember, the patient's coconut is now attached to the bed. Patient comes off the bed, where's their coconut still attached to? Yeah, so we'll make real sure that patient have a lot of tape.
Lots of tape.
Steve, show them that button you're pulling on the bottom.
So this is, basically this will come apart, okay? When you're cleaning it after the case, wipe it down, all right?
Just real quick, if you're tasked to pull the pins out, if you separate the two pieces, you're less likely to stab yourself in the hand on the other side. Separate the two pieces and then pull your pin. Yeah, but if you separate the pieces, you're not going to hit the other side.
Yeah.
That's what people do.
Yeah. So again, this goes down and then we'll tighten it. This is actually a pressure gauge. So you'll see this come out a little bit and we'll crank it down to a certain amount of pressure that they want. All right?
Make sure you have pins in the room.
Yeah,
Certain
that's always
disease, you have the
helpful.
Mayfield, if there's no pins in the room, they will lose their mind.
Yeah.
No, they're on the card.
And the little
Yeah.
tape.
So the thing with the card is, just remember guys, we don't have 4 of everything. We have 2 of some things, okay? So if it's been a busy day, if we've done a cranie in the morning time, how many plating systems do we have? We have 2, okay? If we have another cranie in the afternoon, that plating system that wasn't there is now gone. So it's one of those things where it's every once in a while, Julian will just come by and just check and see what the heck's in here. Because sometimes it gets taken and nobody tells anybody. So,
Yeah,
If you take something, you need to leave a note.
yeah.
leave a note, tell somebody, or replace it.
Or put it back.
Yeah.
Yeah.
I mean, it's an emergency cart for a reason.
Yeah.
Yeah, if you're on call and you use this cart, you really should be putting it back
You
together.
have to.
You have to. Gotta really should.
It's not a, it's a
Okay,
mandatory.
no really should, you must.
The circulating nurse is responsible for restocking that cart if you use it before you leave.
Also, Mayfield does not go downstairs and get sterilized or processed. We wipe it down with the gray wipes.
Yeah, because we used to clean it and take it down and then it disappeared.
Disappeared, it got gummy, the detergents ate the aluminum.
Make sure you wipe it down thoroughly.
Really well.
Yeah, because Sometimes I'll bring it in, it still has hair on it, it still has Bassie on it, it still has blood on it, it still has something on it.
Mm-hmm. Yeah, they're a little scrubby and,
Yeah.
yeah.
How many Mayfields do we have? Just one?
One,
So,
that one.
Don't lose it.
$24,000. We're
Yeah.
working on getting a second one. We've got a lot of things coming up in spine that are coming up due. Our Neuro Navigator, for example, Stryker, I'm not gonna be supporting that in the next year or so. That's $330,000. So that's in the budget. The microscopes, for example, they're $250,000, $300,000 a piece. Please be careful with them, guys. They're not bumper cars.
He's here right now
Yeah,
fixing an
fixing
ocular.
something that's broken.
when those things are in the room, have good hold of it when you move it in there, because it is heavier than heck, and no offense, floors are not exactly even, and it will slide, and it will go straight into the wall. So, those oculars are very fragile, so if they go smash into the wall, there it goes. So,
Question about third flaps.
Yes,
Where do we get that sterile?
In the floor.
in the
Okay.
core.
It's in the core.
It's supposed to be one on the cranny cart for you, but if it's not in the core on my little neuro section, I think it's up. Second shelf down from the top.
And that's like the only one of the kind that we have.
Yeah.
The bags for the cranny flaps, where are they located?
On Saturday,
Mhm.
the nursing supervisor came up and asked if we had ventral ostomy bags. Do we keep those here?
Yeah, that's
They're part of the kits. I don't think we have any separate ones. We have the lumbar drain kits. Yeah, they're in there. We don't have a huge amount. And number two, ICU has them as well. They have an entire cart that they built for A, that had all the lumbar drains and stuff like that. So if you run into that situation where we don't have any, the ICU has some in that. It's a lumbar puncture kit, basically, for VP shunts and things. And they built that for A. I don't know if they've broken that down, but yeah, they should have some in the ICU as well. But we don't have any just like extra bags lying around for it at all. Yeah.
I went to go look for it, but I couldn't.
Yeah, you'll find the kits and that's it. So with thermometer and stuff like that. So, good question. Anything else?
Anybody else this morning? Yes, ma'am.
Happy birthday, Nina.
Have a good